Hello there. My name is Dr. Martina Assad, and I'm the owner dentist of MA Dental. We are located on Van Buren in Riverside, California, and today we're going to be talking about a really interesting topic, which is tooth decay or tooth cavity, pretty much. So, tooth decay and the definition, what it is, and it is pretty much the tooth bug, the black spot or the brown spot, or sometimes even white spot or yellow spot that goes and it starts by food deposits on there when a patient's not necessarily um, when their hygiene is not necessarily optimal. The food kind of breaks down and it becomes acidic, and then it kind of sits in between the teeth where flossing becomes super important. But as the food doesn't flush away because of whichever condition the oral cavity is in, it kind of sits and it turns into bacteria, and the bacteria starts to eat the first layer, which is the hardest layer in the entire mouth, which is called enamel, and the body too. And then after that, it turns into brown, yellow, sometimes black or white, and it starts to eat the tooth little by little, and you start to see the tooth kind of becomes weak on the inside, so it almost looks like an eggshell. The shell is really hard, and as soon as you touch it, everything else crumbles, and the tooth becomes no longer workable. So that's pretty much tooth decay is. So what causes dental decay? And it starts, unfortunately, imprinted in our genes, genetics. If you get a bad gene from parents, or if you get like not so healthy of a tooth gene, that happens. For children, if mothers and fathers and relatives, their oral cavity isn't the cleanest, and you start to kiss the child, especially closer to the mouth area, he'll get a cavity. Also for children, they sleep with bottles, milk at night, problem, or formula. You must stop that milk 2 hours before bedtime. You must keep their mouth clean. Snacking is a big reason. Oral hygiene, and of course, follow ups at the dentist. Faulty restorations, bad, all the restorations, things that are opened. Misaligned teeth could be a reason why people get cavities because they can't get into the areas to brush and floss. There's tons of reasons why people can, but sugar for sure. So lots of reasons. So what signs and symptoms? Signs. What are the signs of tooth decay? And it usually starts to turn a different color. When you see something that looks different, please seek a dentist. Pain sometimes. Cold sensitivity is a big one. And biting sometimes feel when people eat sweets or cold, they're like, oh, I feel a little bit of a zap here and there. Some people are more sensitive to cavities more than others, but it usually, sometimes even no signs or symptoms, like you're going for a visit and then the dentist have an early detection, which is, it's important. But generally speaking, it's like sensitivity, cold and sweets. That's where early cavities kind of start. Effects of tooth decay overall. I always say that the mouth or the oral cavity is connected to this body. You cannot just detach the mouth from the heart, the brain, the lungs, the arms, the foot. Same thing like the heart. You can't detach the heart from everywhere else. The person would not be alive. Same thing. The oral cavity has a huge impact on your health, and it's vice versa. If you're a person that your health history is not controlled, not well controlled, like you have diabetes, you have blood pressure, cholesterol, anemia, it will impact your oral cavity quite a lot, especially with healing and gum health and bone health and the sound, how sound your teeth are. And it's the other way around. If you have bacteria, you sleep with this bacteria all day and all night long. You kind of carry it with you, and you can actually give it away, and still multiplies and stays there. And when it stays there, the first place it would get back down to your throat, goes up to your brain, goes down to your lungs, goes down to your organs. So everything is connected, and it's very unfair, usually for people or patients, to look at everything else but their teeth. And a lot of times the mouth is not prioritized, especially if you're from a different culture. Or, I mean, growing up, that was the last thing people around me did. They just cared about having a roof, which I understand. Like, they're very poor people. Um, Having a roof on top of their head, or maybe eating meat once a month. And everyone around me neglected their oral health. I was very fortunate that my parents were educated, and I remember my dad growing up, they would buy us the little tools because sterilization and sanitization, like the things being sterile back home was very difficult growing up. So he would buy the tools and he would just take it to the dentist and he would actually take us to appointments. And but that's maybe one person out of 20, one family out of 100. Same thing, I see it till this day. We have parents that, or even adults, like they have a huge treatment plan, and it could be time frame, finances. It's usually time frame and finances that get between us and the patient. And we keep educating them. I keep advocating for them. My team does as well. We keep fighting for, for your own sanity and your own good health. And then we see the health deteriorates year to year, and it comes to a point where it's point of no return. If you have a good set of teeth, keep it. It's better than anything we put in. So can tooth decay return to normal? And if it's early stages, it doesn't necessarily return to normal, but it can arrest and die. I am very hardcore believer in prevention. Early prevention is better than drilling. Drilling, as soon as you drill on a tooth, it does not grow back, unfortunately. I would prefer to prescribe there's a certain toothpaste prescription that we love to prescribe and educate patients on. If you use it in a certain way and you floss with it and you keep it on, your cavity might die and you might not have to do nothing. That's kind of like the most economic and healthiest way to take care of an early cavity early on. As soon as it gets to the point between the hard surface, which is that we call it enamel, and then the soft surface inside, it's like the inside of the egg or inside of the tooth, it's a point of no return, unfortunately. So with all respect to the holistic dentists out there, and the holistic methods are great. I'm a hardcore believer in those too. But sometimes, about 90% of the time, we have to intervene because it's too late. So what are treatments or some treatments of tooth decay? And we're pretty much remove it and fix it and build it up and put something instead. You cannot leave your tooth open. It'll start to ache. The nerve is in there. It's like a GPS. So treatments, it could start as simple as filling when the cavity is too small and you're not losing like a quarter of your tooth or a half of your tooth. As soon as you lose a quarter of your tooth, a hat is required, crown. Now it progresses. Now it's not just a quarter or half of tooth is missing, it's also the inside is affected by the midline or the inside of the tooth where the nerve is in. As soon as the cavity gets there, so when you do a root canal, and as soon as the cavity gets past to 60 or 70 or 80%, depending on the situation of the patient, it becomes non-workable. And this is how you get a swelling and pain nonstop. And then at that point, tooth loss is necessary. The very important concept or topic or question, how do I stop the tooth cavity from spreading? First of all, go to your appointments with your dentist. Do not skip an appointment. It's very helpful. Again, early detection beats everything that we do. The second thing, stick to your oral hygiene regimen. Oral hygiene, it's like, again, maintenance. When you get any procedure done, anything, or you buy something new, you don't maintain it, it goes down the drain. Same thing. If you see early signs, make sure you mention it to your dentist and get it treated right away. Do not let it go. And also, you can do things at home, like again, the toothpaste that we talked about, the prescribed toothpaste. It all starts with you visiting your dentist on a regular basis, so you don't let it go, but also sticking to a good oral hygiene regimen and educating those who are around you, so they can also stick to that. Tooth decay painful? And the answer is not always. About 50% of patients that we usually see, maybe even more, they have really small cavities. They're called incipient or early cavities. Those usually don't hurt. But again, early prevention beats everything we do. At that point, when a patient is feeling something, that means you have gotten to a point of not being reversed or non-reversible. When you're in pain, and technically speaking, you've gotten to a point where it shouldn't have in the first place. So just like the air around us, just because you don't see it, that doesn't mean it doesn't exist. So if you have an appointment, don't skip it. If you reschedule it, make sure you reschedule your appointment. But tooth cavities, usually when you feel it, that means you've gotten to a point that is not necessarily dead or arrestable. It's to a point where we have to intervene. And with that ends today's video. I hope you enjoyed the topic on tooth cavity. It's actually a really good topic. A lot of people ask about cavities, and I didn't know that I had a cavity. But again, you do not necessarily need to feel it for a cavity not to exist. If you do have any more questions, comments, or concerns, please do not hesitate to call us at 951 327 7247. We'll be very, very excited and eager to meet you and welcome you.